This is WSUM, and I'm your host, Erica Gelman, and I am here with
Brennan Barr.
Elm Stevenson.
Rishabh Kishore.
And we have a special guest with us today. Why don't you introduce yourself?
Hi, I'm Doug Jorenby.
And with Doug Jorenby, we're going to be speaking about, and he's Dr. Doug Jorenby, we're going to be speaking on tobacco and smoking cessation and what that means in terms of e-cigarette use, cigarette use, and other forms. And we also have a disclaimer that we want to present. The opinions expressed in this show do not reflect the views of WSUM, University of Wisconsin-Madison, or its Board of Regents. So I guess the first question I want to ask you, and this is kind of a no-brainer question, but what is your position? What do you do here at UW-Madison? Why is this topic important to you?
Well, I'm a professor in the School of Medicine and Public Health, and primarily I'm at the Center for Tobacco Research and Intervention, where I direct clinical services. So do a lot of research into nicotine dependence and helping people quit smoking. And e-cigarettes are something that have just really erupted in the last few years on the scene there.
Mm-hmm. And then, so e-cigarettes. So to my understanding, and I could be wrong, e-cigarettes were kind of created as a way of getting people to stop smoking real cigarettes. Why is it now a problem? Why are we trying to stop e-cigarette use?
Well, I don't know that we're trying to stop it, but there are some concerns, and part of that comes from the fact that these are very recent technological developments. The what we call an e-cigarette was patented in about 2002 by a Chinese chemist, but in the U.S. their use just really exploded, and in terms of people in the public health community, pretty much blindsided everybody how quickly these became popular. And it's interesting the phrase you used about helping people get off cigarettes, because about the only thing we can say with certainty, at least in the U.S., is that the U.S. Food and Drug Administration has never allowed e-cigarette companies to advertise or make claims that e-cigarettes help people quit smoking tobacco, traditional cigarettes.
Mm-hmm. That's really interesting. So I guess let's back up a little bit. Can you educate us on why cigarettes are bad for us? Because I think sometimes people tend to forget.
Well, the simplest way to look at it is cigarettes, when used as directed, are going to kill about 1 in 2 users ultimately. You can trace the metabolic pathway of a cigarette pretty much from the point where it touches somebody's lips, completely through the body, the lungs. A lot of it is metabolized through the kidneys, and pretty much from the lips all the way to where it passes out through the urinary system. You see increased risk of cancer every point along the way, increase in heart disease, in stroke, in chronic obstructive pulmonary disease. It kills people in so many ways, and some of them are quite prolonged and painful.
Mm-hmm. And then e-cigarettes. So what do we know and what do we not know about how safe or how dangerous e-cigarettes are in comparison to cigarettes?
Well, there's a tremendous amount that we don't know about them at this point, because well-conducted scientific research is really in the early stages, although the feds in particular have really scrambled to try to make up for lost time with that. Some of the things that made e-cigarettes appealing at the very beginning are still true. They're not combustible the way cigarettes are. So things like carbon monoxide that people inhale every time they puff on a cigarette, there's none of that in an e-cigarette. The amount of nicotine is quite variable compared to what you see in typical cigarettes, combustible cigarettes. Some of the combustion products that are carcinogens that are in cigarettes, the things that contribute particularly to the cancer risk, don't seem to be as present in e-cigarettes. Unfortunately, what we are starting to learn now is that there are some combinations, some of the chemicals in the solution, the e-juice, particularly propylene glycol, when that gets heated to a temperature to create the vapor that e-cigarette users, that's the delivery system instead of smoke. That can cause problems with the lung, a condition that goes by the name of popcorn lung, and it's pretty much what it sounds like. More recently, there's been some research into specific flavorings that make some of the e-juice varieties popular, particularly to younger people. And those, when they're heated to high temperatures, seem to have a cancer risk associated with them.
And is that related in any way to the decision by the Food and Drug Administration to limit the sale of these flavors, or is there another component to that as well?
No, the flavor definitely has been a low-hanging fruit. And I use that term with intent because some of the flavors that were really singled out. I mean, you look at them and it's just sort of outrageous on the face of it. On the one hand, you got to kind of get the classic Marlboro Man cowboy out there riding the range with smoking his cigarette, and on the other hand, you have Fruit Loop flavored e-juice. There's one brand in particular that markets their fruit and candy flavored e-juice literally in packages that look like juice boxes, like you might give to daycare kids. So some of that really was obvious that it drew that attention. It was very interesting that Dr. Gottlieb and the FDA in making those decisions singled out menthol and mint flavors as basically hands-off, and that was kind of surprising.
What do you mean by hands-off?
That they've made specific exceptions. So under what the FDA is recommending, flavors like fruit, like candy, like breakfast cereal type things will not be allowed to be sold in convenience stores and gas stations. You have to go into a specific, e-cigarette vendor kind of specialty store where they check IDs and have much tighter control over it. But if it's implemented as suggested, you can walk into the Quickie Mart and there will be tobacco-flavored e-juice, there'll be menthol, there'll be mint. And when Dr. Gottlieb was talking about that, he specifically said that they want to have those available in the idea that people who might want to use e-cigarettes to get off combustibles would have easy access. They didn't want that to be a barrier.
Mm-hmm. Now, I've done some projects in previous classes because this is a topic that actually interests me a lot, and on menthol cigarettes and menthol e-cigarettes. And I know there's something special about that, in that people who start smoking menthol cigarettes or menthol e-cigarettes are more likely to not quit, things like that. Do you have anything you want to say about that?
No, other than that's always been an anomaly, and you're right, and that goes back decades with menthol cigarettes. Because of the effects of the menthol, people seem to be able to draw the smoke into their lungs deeper, hold it there longer. It's very much associated, much higher rates of menthol use in the African American community, and at the same time, the tobacco companies have aggressively marketed menthol cigarettes to those communities as well. That's also associated with a higher risk of a particular small cell form of lung cancer that is particularly aggressive and fatal. So that's very concerning. And in the same announcement where Dr. Gottlieb was talking about pulling the candy and fruit flavored e-juice out of convenience stores, they were also talking about potentially restricting menthol cigarette sales, which is completely new for the federal government.
Mm-hmm. So no one has ever talked about this before then in terms of cigarettes with reducing menthol sales?
Well, actually, it was considered in the 90s during the Clinton administration and basically got shut down. There was a lot of pushback about it.
And then, let's talk about, do you know anything about the addiction process or the addiction model? Does it differ in any way between cigarette use and e-cigarette use?
They're starting to converge. But the early generation technologies for e-cigarettes were actually really terrible at delivering nicotine.
So that was like, let's say, 2015? I don't know.
Yes, in the Stone Age.
No, just because in my high school, I was, so the reason I'm really interested in this is because in my high school, like, e-cigarettes blew up, the big box vapes, and it was like.
Are we talking literally or figuratively?
Probably both.
Yeah. Well, they like kids would go into the bathroom with these like huge machines and just like smoke in the bathrooms, and it's kind of funny, just like how weird it was. So that's why I'm asking, because I was curious about.
Yeah. I mean, in one sense, it's incredibly tough. If you took a pharmaceutical company and you gave them kind of an unlimited research and development budget, they would be really hard-pressed to come up with a better delivery system for a drug than cigarettes are. When you inhale on a cigarette, within about 7 seconds, nicotine is getting to the brain because it goes through the lungs and the capillary bed there. It's incredibly fast. So the early generation technology for e-cigarettes, and not those mod systems that people were using in your high school bathroom, but the flimsy little throwaway plastic things that actually look like cigarettes, were almost indistinguishable from placebo in a lot of cases.
Oh my gosh.
But the technology has advanced, and it's advanced very quickly. And so you started to get these mod or these tank systems that had bigger batteries, they had much better cartomizers, and they were able to deliver, especially with high concentration e-juice, a more significant dose of nicotine. It's interesting that you mentioned seeing in the bathroom, people making big clouds of vapor. For actually a short time, cloud chasing was actually a big thing that was desirable for people vaping. And then Juul came along. Mm-hmm. And particularly in the high school context, the couple things about that is, one, if you're dealing with teachers who aren't really clued into technology, you can pretend that it's a USB drive that you're carrying around, not your vaping device. Number two, it doesn't produce those huge clouds of vapor, which makes it easier to conceal if you're trying to do that. But the biggest thing is Juul was kind of the first out of the gate with combining freebase nicotine in the e-juice with an acid. And that creates a nicotine salt. And that makes a huge difference. It's not quite as effective as combustible tobacco, but in terms of delivering that spike, that buzz of nicotine, it's much, much closer. And so that makes it a more rewarding experience, particularly for smokers who are transitioning to vaping.
So smokers transitioning to vaping. What's the difference then between how those individuals use e-cigarettes, and then is there anything significant with the fact that kids are starting with e-cigarette use, not even with cigarette use?
Yeah, and you nailed both of those. Those are the things that have got the public health community really up and looking at this in a big way. The one that we've known almost since people started paying attention to e-cigarettes is people who are already dependent on combustible tobacco, cigarette smokers, if you will. A lot of them, even though e-cigarettes were never advertised, there's not really good data to suggest they're a way to help you quit smoking, but they were incredibly appealing to smokers, and so they started using them. And what we found is a large proportion, like almost 60% of people who are dependent on tobacco that also vape, end up using them together. They're what we call dual users, so which means they're not getting off cigarettes. So they're still exposed to all those things we were talking about earlier, that there's really no public health benefit to them being dual users. And that's a big concern. The other part that you mentioned, though, is in recent years, we've now got good national data that suggests, particularly with adolescents, that people who never tried a cigarette, started vaping, are at much higher risk then of switching over to cigarettes. So their vaping experience leads to them picking up cigarettes and either dual using or transitioning to smoking straight up.
Mm-hmm. Is there a difference in nicotine content in things such as the Juul or other e-cigarettes compared to the average cigarette?
A lot of it depends, particularly with e-cigarettes, because e-juice is almost infinitely customizable. In theory, there are some limits as to how concentrated the nicotine can be. The European Union is actually much better at enforcing those than we are here in the States. But the combination of being able to adjust the content of e-juice with the technology, how big is the battery in your unit, what kind of a cartomizer are you using? Are you actually using the device as intended, or are you dripping the e-juice directly onto it? All of those can increase the nicotine level pretty substantially. And that's above and beyond, unfortunately. I mean, we were joking before about e-cigarettes exploding, but they do. And there have also been a number of cases every year of infants, very young people, either drinking e-juice, or nicotine is absorbed easily through the skin. So even getting concentrated e-juice spilled on hands can lead to an overdose, and with very young kids that can be fatal, unfortunately.
Mm-hmm. Let's see. Have we seen any? I know you said that we don't really have a bunch of data on e-cigarette use. Have we seen any negative health impacts besides popcorn lung?
That's the one that's been most salient. But the thing I would point out, and I think we're going to do better with this than we have in the past, but when you look at the trajectory of cigarette use, in the United States, men started smoking at higher rates just after the turn of the 20th century. It really started to take off in World War I. And it wasn't until 40 years after that we started to see in the public health data a real spike in lung cancer cases, which is almost exclusive to smoking. It was only in the mid-1950s that some really astute epidemiologists started to pick up on an increase in heart attack deaths among smokers. So there's decades of lag time. And I think that's one thing that myself, my colleagues, and people around the world who are concerned about this are really trying to get out in front of. We don't want 40 years from now there to be some kind of lurking, massive public health problem that came from vaping because nobody was looking for it.
Mm-hmm. So then I guess one of the last questions I'd want to ask is how do we stop this problem then? What are your solutions? How do we get people to, first of all, not pick up, how do we prevent this issue? And then also, how do we get people to quit?
Yeah, well, in terms of the first question, and I think one that has probably the most immediate public health impact is exactly what the FDA is suggesting, that let's not make it incredibly easy for people who might otherwise not even get exposed to nicotine to start vaping and then transition to smoking. So that policy is moving forward. We'll see how that plays out. In terms of the other, it's really up in the air right now. I mean, we still don't have fantastic ways to help people quit smoking in the first place, which, if anything, would be the biggest public health impact. We're still working on doing better with that. It does look like in a lot of cases, people who smoke and vape who are dual users give up on the e-cigarettes after a certain period of time. We're tracking a group of people where we're seeing some signals of that now. So in some ways it may be time limited. And then I think as we do more good quality work, we're going to get a better sense too of how much is this a harm reduction thing? Our e-cigarettes, they're not without risk, but how much less risk do they have than people continuing to smoke cigarettes?
Mm-hmm. Oh, I guess I have one more question. I was interested. So we know that caffeine, if you take a lot of it, it does impact your life. It impacts. It can take away years from your life if you consume, say, 3 or 4 cups of coffee a day over a long period of time. You can get rid of maybe 3/4 of a year of your life. But at the same time, caffeine also has some health benefits to it. Can you say the same thing about nicotine? Does it have any benefit? Let's say, does it make you concentrate more or anything like that? Is there any benefit to nicotine besides perhaps a good feeling?
Well, let me twist that a little bit differently and to say that what we were talking about at the beginning of the show in terms of the health impacts of cigarette smoking, almost all of those are due to the delivery system, to the smoke and the combustion. Nicotine itself, outside of a very small number of cases like women who are pregnant or somebody who's just recently had a heart attack, some exceptions like that, it actually isn't particularly harmful, at least at the doses that we administer to ourselves. It does tend to, and this is ironic given what we were talking about before the show started, but people who have to stay alert and focused, particularly on things that maybe are a little bit intrinsically boring, nicotine does help with those kind of cognitive tasks. It helps focus people's and sustain people's attention with that.
I have a question.
Yeah.
If it can be absorbed through the skin, why not just put it in products that don't have to be combusted, like lotion or something?
Well, like the patches.
Yes, exactly. That's what I was going to say. Yeah, the nicotine patch is approved. It's actually one of the better treatments that we have for helping people quit smoking. And part of that is because it's absorbed through the skin, you don't get that buzz or that rush that people find appealing. So it helps reduce the withdrawal symptoms without sort of replacing it with something that's new and tempting for people.
It's like the new fad is going to be nicotine patches at parties.
Kids walking around with 12 of them, all up their arms.
Yeah.
Okay. Is there anything else anyone else wants to say? Any other questions? Do you have anything else you'd like to add? that?
No, it's been a great discussion. Thanks
Awesome.
for inviting me over.
Thank you so much. And then let's continue on to the show. Once again, this was Dr. Doug Jorenby, who's a professor at the School of Public Health. Sorry, the professor of School of Medicine and Public Health. And we spoke about smoking cessation, vaping, and e-cigarette use and the implications of all of these three things. Thank you so much.